It was a health center for staffing. It would up at least many staff who can accommodate it. So we request the government, if in its way they can give us a health center for Nakivale, to make sure that all refugees and other nationals are served at the same time. We also want to increase our coverage and our coverage in terms of medication, in terms of tracking for babies, for mothers. So all diameters should be touched on. Let it be OPD, let it be in maternity, let it be in pediatric, because now we have a lot of TBs, because people are very many. And the TBs track it, we have to intensify. So we ask government to give us a hand as the Sindro district, such that things can be worked out and as a service system becomes better to us.
My name is Paul Mushao. I'm the refugee welfare leader, Nakivale Refugee Settlement, which is located in southwest of Uganda. On behalf of refugees, we deeply appreciate the service that we have benefited from this medical camp. The people are so happy because they have got the treatment, and those who are going to receive the referrals, they are looking forward to it. And it has come in the right time when we are facing the global crisis about the refugee response. So we deeply appreciate so much, and we wish this medical camp could continue even more so that we can continue to benefit from this kind of health service. Otherwise, on behalf, we thank so much the Office of the Prime Minister and their partners to continue supporting refugees, not only in Nakivale, but across the country. We are so much grateful, and we are very thankful for the service that we continue to receive on a daily basis.
It comes at a time when we are lighting the candle for HIV/AIDS. Of course, following the revelations that Lutaya made, that he was very positive. These refugees, of course, we have services under HIV/AIDS program, and especially in Nakivale Health Center 3, where we are, where people go for testing, they go for counseling, those who require counseling services, and the treatment on ARVs. Thursday has been a day dedicated for all of these activities for those who are testing. And this can now be only 4 times in a week, in a month. But with this camp, which has brought hundreds of refugees and nationals to come and voluntarily test and identify, find out their position, has helped us. It's a camp that I would feel that we should continue once in a while conducting in this refugee settlement. But the medical camp is not only managing HIV/AIDS testing, it's also, we are also testing TB, we are also testing cancer, screening for cervical cancer and breast cancer for our women who are the majority. The prevalence rate of HIV in Nakivale, it's at 2.4%. This is below what other settlements are, but we were worried that the cases are now increasing, because originally, out of 10 people that would voluntarily test, 7 would be Ugandans, the host community, and 3 would be refugees out of the 100 that would test. But now it's almost 50-50, because our refugees are getting challenges of coping up, dangerous coping up mechanisms, especially now that their ration has been reduced. They go outside the settlement where transitional sex is taking place, and therefore they are at the risk of getting infected from people outside the settlement in exchange for food and in exchange for money.
Facilities ezo twine omu zoona nk'izi naamara kugamba twine egi Nakivale, twine Rubondo, twine Juru, twine Kibingo, twine Nshungyezi, twine Rurongo. All those ezo zikukakinga apa empungi zikuruga aheeru. Gavumenti etuyambe abakuba empungi niziija omu bwingi kandi abashaho baba bari bakye. Mbwenu twantenda ngu gavumenti yaba nerecruitinga tutemu effort egyo batuhereze abashaho b'empungi bari permanent kabashashurwe gavumenti. Akuba kuba kutayo abashaho ba eb'ebitongore ebi ebindi baraka kubiihayo babaha contract ya 5 months 2 months bagenda kuba kugenda itiita bakuba tutwiremu kandi turi permanent. Mbwenu tushanga twakora munonga oshanga tuyinde bwehigiro. Mbwenu naninshaba gavumenti kuyakubaasa kuhereza Nakivale a health center for kikabagi ahakuba is a center of excellence. Mbwenu yamara kuja health center for nkimanyisa ngu all services will be done here, then referrals will be niza kukyendera haza abantu twena tubakorera na nitwe tugume tureta n'abandi nationals abandi abahare nabo buna bijaha omu mpungi kutunga obuhereza.
This camp has been very successful. We've seen a number of people, only that what I can say is that it has been for a short time. And to make this place serve better and even the camp being more successful, we need more days, but more so is to elevate this facility to a higher level because of the catchment area. And not only elevating, but even concomitant with the resources that are due for, like maybe for a hospital, because it is very populated, the services are really very much needed, and I really appreciate the partners who are helping, because at least it is a health center 3, but is having about 111 staff. So other partners like medical team international are helping, and the others. Otherwise, if it was only for government, then it is very minimal. So if they elevated it to really serve the catchment area, we should have a lot of commodities needed, essential medicine and supplies needed, which we found as a gap here, because you could prescribe a drug, but it is not there. There are many surgical cases that are wanted. The theater is very good, the staff are there, but of course also very few. So if they improve everything, human resources for health financing, the health commodities, I think it will give better services.